Hello, good afternoon, everyone. My name is Chad Royer, and welcome to my channel, What's Up with Chad Y. Royer. I'm talking to you as a cancer patient going through his journey battling multiple myeloma. And I'm just putting this up because I'm going to be discussing these terms over here: minimal residual disease, also known as MRD, clonoSEQ, and adaptive. Folks, if you haven't done so, please like and subscribe to my channel so that you know that when more videos are coming up. Please turn on your notifications, tell a friend or two, and if you have any comments, words of wisdom, questions, feel free to flood the comments. So the last video that I did, I mentioned that I had some updates, some positive updates, some good news, and I'm about to get into it as best as I can. I also want to give an acknowledgement to my cousin Reynold. It's his birthday. Happy birthday, Reynold. And happy birthday to my kids. Their birthdays are in the summertime. So wonderful seeing them grow and blossom as they do all the time. Now, I just want to go over a little bit of terminology here. So I have my sheet right here. And the doctors and I had a discussion about the results. So let's just get into it. And I'm just going to jot down some notes so that I can articulate it as best as I can. So MRD, which stands for minimal residual disease, that determines the absence or presence of detectable cancer cells in the system. It also measures like the outcomes of that test. We want to see extended lifespan, lower chance of relapse, and longer remission duration. So if your MRD is negative, then chances are you do not have any detection of the cancer cells in your system. Now, although it's not a guarantee of a cure because multiple myeloma does not have a cure, it's the best way to detect the presence of cancer in the system. It's the most sensitive test. It's FDA approved. In fact, the name of the test that they use to get these results is clonoSEQ. I have it spelled over here. CLONOSEQ. It's actually an MRD test that doctors use to detect small amounts of the cancer in the system, and the company is called Adaptive. They produce clonoSEQ. Now, as I mentioned, MRD is used to test the effectiveness of the treatment that the patient goes through when they're fighting this type of cancer. And it predicts the chances of a relapse. So let's say I'm at the closest stage of remission. There's usually a time period where you can expect not to detect anything. But in some cases, and some people, cancer comes back. Sometimes it comes back 7 years, sometimes it comes back 20 years, sometimes it comes back a lot sooner than later, a lot of asterisks there. And, that type of test was used. And in my case, my MRD was negative at 10 to the exponential of -6. So we're talking about out of a possible 1.9 million cells in the body, and we're talking about nucleated cells, cells that have a nucleus. The test did not detect any cancer cells left in my body. In fact, it gave a range between 0 and 1. So I am deemed MRD negative. This is the closest to remission that I can be at this point. And if you rewind several months ago, when the presence of the cancer was somewhat aggressive and active in the system, now the numbers are all the way down. So I got the news. I was so happy to share it with a few folks. And one of the reasons why I didn't put this video out sooner is, I don't know if you can tell, I'm not feeling so great. I have symptoms of coughing a little bit, blowing my nose, spitting, mucus buildup, and it's been bothering me for a few days. It got the best of me yesterday and almost the best of me today. So although this is great news for me, I am physically not at my best right now. But I'm doing what I can. I'm walking, trying to drink as much water as I can, trying to eat, try not to miss any meds. And speaking of meds, I started the clinical trials already for the new drug ibutamide, but I was randomly selected to be on Revlimid. I can't even say the word. Remlivid, and at a different dose. So the way that study is going to be used, I am the one that's taking in the sample or the dosages of Remlivid. Every cycle is approximately a month or 4 weeks. So the first 2 cycles, I have to draw blood every week. So that's 4 times in a week. Maybe 5, depending on the month. On the 3rd cycle, which would be the 3rd month, I would go every 2 weeks. In the 4th week and so forth, I will be drawing about once a month. Maybe twice, depending on the calendar. That hasn't come up yet, but that's what that's looking like. So I am taking Remlivid as I have taken before, but instead of taking it with another blood thinner, I'm taking it with aspirin, which has been known to thin the blood. I was taking Xarelto before, but it has been determined that I don't need it. Thank goodness, because that drug is not cheap. It is very expensive, or quite expensive, actually. I don't want to exaggerate too much. So I'm currently doing the clinical trial, yet I'm taking a temporary pause on it so that I can get the symptoms to go away. I need to let the symptoms subside, and then I can continue taking it. So far, I have not had any symptoms such as dizziness or lightheadedness or fatigue, or heavy fatigue rather, or any skin rashes. I have none, no skin rashes. I've been fortunate because I know those were some things that people have mentioned that they've had before. So this is the news that I wanted to share, that the cancer is not detectable in my system, and they use the test called clonoSEQ to do it. It's one of the most sensitive tests in the industry for the type of cancer that I have. And right now, I'm in the stage called the maintenance stage. The maintenance stage is important because we want to keep the cancer at bay. So that'll be a new stage or a new journey that I travel as a cancer patient, or I should change that, a cancer survivor. Yes, I am a cancer survivor. And I'll be honest with you, I had to hold back tears. It's okay to cry because I've cried a lot. But this is a victory for me. This is a victory for my family. And I'm hoping that this is a victory for you. I know a lot of you have reached out randomly, periodically, occasionally. It is much appreciated. I just want to thank you for tuning in. There'll be more content coming up. I hope by the next time that I shoot my next video, I will be free of my symptoms. I won't call it severe cold symptoms because it's really starting to make me feel a little achy and not so nice. But I'm doing my best. So, again, thank you all for tuning in. Be sure to like my videos, subscribe, tell some other folks, share my story. I want to hear from you, either on the platform or outside the platform. It's perfectly fine with me. You take care. You be well.